Good day, everyone! I am Mariah Angela F. Pineda from BS Nursing 1, and my task is to perform proper hand hygiene. Hand hygiene is an essential method in reducing the number of microorganisms and bacteria in our hands. Also, to prevent the disease-causing germs between the clients, to lessen the possibility of cross-contamination on our clients, and to take control of the spread of the pathogenic germs from one individual to another. Going on with the assessment, we have to identify the factors susceptibility to infection and the potential undetected or undiagnosed infection. This will also help us to assess the medicine inhibiting the immune system and the procedures entering the skin or cavity for us to get diagnosis and treatment. Lastly, to assess the current nutritional status. Also, identifying the signs and symptoms, and under the local signs included are redness, swelling, pain or tenderness with palpation or movement, palpable heat at sight, loss of function on the body part, and the presence of exudate. On the other hand, the systemic indications are fever, increase in pulse rate and respiratory rate, loss of energy, anorexia, and enlarged lymph nodes. Going on with the procedure, we have to locate the running water, the soap, or any soap alternatives. Here is the running water, and here is the soap. Hand hygiene is a skill that must be learned by everyone, especially in the healthcare industry. Even the unlicensed and assistive personnel, or the UAP, and all members of the healthcare team has the responsibility to wash their hands properly for the sake of others as well as themselves. All medical professionals should be able to wash their hands properly. So the equipment needed are the running water, the soap, and the paper towel. We also have to take note of these things in assessing our hands. First, we should keep the length of our nails as short as possible. As you can see with my hands, it only has short nails. In most situations, workers in direct contact with their clients are not allowed to wear artificial nails because all artificial nails are prohibited by the CDC and the WHO. The rationale for this is that short natural nails are less likely to house pathogens, to harm patients, and to puncture a glove. Next is that it is recommended for nurses or medical personnel to remove all jewelry. With my case, I don't wear any jewelry. The rationale for this is that microorganisms can be found in our jewelry or beneath the rings, and hands and arms are more clean if they are not around or if these jewelries are removed. Next, we also have to examine our hands for skin damage like hangnails or cuts. So examining my hands, I don't see any hangnails or cuts. So the rationale for this is that due to the danger that the infection brings, nurses who has open sores will be relocated to a working area that has a lesser infectious organisms. So begin by introducing yourself, what you are going to do, and why it is necessary. Today, I am Mariah Pineda, a student nurse, and I will perform proper hand hygiene for the safety of my client as well as myself from the transmission of microorganisms. Then we have to turn on the water, and take note that there are types of faucet handle or faucet control. First is the hand-operated control, the knee lever, the foot pedals, the elbow control, where you use your elbows instead of your hands, and the infrared control, where you move your hands in front of the sensor so that the water starts and stops flowing automatically. So what we have right now is a hand-operated control. Turn on the water and adjust the flow. Adjust the flow so that it is warmer. The rationale for this is that Warm water removes less of the protective oil on the skin than hot water. Then, wet your hands and arms. Let the water run down from your elbow to your fingertips. The rationale for this is that hands are more contaminated than the lower arms, so it just makes sense that the water is running from the least contaminated area to the more contaminated area. Observe that this procedure is different from the ones used in surgical hand washing. Nurses will learn to perform in washing their hands thoroughly when they are working in the operation room. Then, add soap. If the soap is liquid, add 4 to 5 milliliters or 1 tablespoon. And if the soap is a bar soap, granules, or sheet, rub them firmly on the palms. Rub them firmly and in circular motion so that we can wash the back of our hands, the palm, and our wrist. Also, we have to include the heel of the hand. And the WHO in 2009 recommends the step right palm on the left dorsum with interlaced finger, and also vice versa. Left palm on the right dorsum with interlaced finger, then palm to palm with interlaced finger, then the backs of your fingers on the opposite palm with interlocked finger, also on the other hand, then rotational rubbing of the left thumb clasped on the right palm. Also on the other hand, right thumb on the clasp on the left palm. Also, do not forget to include your wrist. And do this routine for 30 seconds. You can also use 2 happy birthday songs as the length time of your hand washing. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Happy birthday to you. The rationale for this is that circular motion provides a friction in the complete removal of germs, and the interdigital gap can be cleaned by the interlacing fingers and thumb. Then, rub your fingertips on the opposite palm. And also the other hand. And the rationale for this is that fingers and nails are often missed during the hand hygiene. Then, rinse our hands. Then, Pat dry the hands with a paper towel without scrubbing. The rationale for this is that moist skin chap readily as the dry skin is rubbed vigorously, and chapping produces lesions. Then discard the paper towel on the appropriate container. Now, we have to turn off the water with a new paper towel. Then discard the paper towel. And the rationale for this is that new paper towel prevents the nurse from picking up the microorganisms from the hand control. And if desired, use hand lotion. Use hand lotions that are only approved by the agency, because if not, the hand hygiene will be less effective. The latex gloves can break down, and also dispensers may be contaminated with bacteria. And the rationale for this is that hand lotions are necessary to keep our skin from drying out and irritation. Now going on with the variation of washing our hands before performing sterile skills. So wash our hands with water and soap, just like we did a while ago, but keep our hand above our elbows. Let the water run down from the fingertips to your elbow. The rationale for this is that the water will run down from an area that has the fewest microorganism to the area with a greater number of pathogens. Then do the routines a while ago. Once done, rinse your hands, letting the water run from the fingertips to your elbow. Then dry your skin with a paper towel, moving from the fingertips to your elbows in a circular motion. Then discard your paper towel in the appropriate container, and then use another towel in drying your hands from the fingertips to your elbow. Then discard. And the rationale for this is that new paper towel will dry the hands from an area with the least cleaned hands to the area with the most or the cleanest area. Then again, turn off the water with a new paper towel and discard. The evaluation is that there is no proper or established method of evaluating the nurse's hand washing techniques, but institutions recommend this skill so that we can prevent ourselves from transmission of microorganisms. And that is all. Thank you and God bless.
Good day everyone. I am Mariah Angela F. Pineda from BS Nursing 1. And the task that I have to accomplish is the proper donning and doffing of personal protective equipment or the PPE. Included are the gown, clean gloves, mask, and eyewear. So the purpose of this procedure is to protect the healthcare workers and the clients from the transmission of the infected materials. Assessment is done by considering which activities will be required as the nurse is in the client's room at that time. So the rationale of this is that we can determine which equipment is needed. going on with planning, we have to know that the application and removal of PPE is time-consuming. Prioritize care and arrange the personnel to care for your other clients if indicated. Then determine what materials are present in the client's room and determine also the materials that are needed to bring in that room. Consider any special handling, if indicated, of any specimen or other materials that is there. Equipment as indicated, which activities will be required. Make sure that extra equipment or materials are easily available. So the main equipment are the gown, gloves, eyewear, and mask. So now going to the actual implementation, remove or secure any loose items such as name tags or jewelries. As in my case, I don't wear any loose items such as jewelries or name tags. Prior to performing the procedure, introduce yourself to the client, what you are going to do and why it is necessary. Good day, I am Mariah Pineda, a student nurse, and I'm going to don and doff the personal protective equipment to protect myself and the client from the transmission of the microorganisms. Now, we perform hand hygiene. Then, apply the clean gown. Pick up the clean gown and allow it to unfold in front of you without allowing it to touch any soiled area with body substances. Then slide your hands and arms through the sleeves. Then, fasten the ties at the neck to keep the gown in place. Then, overlap the uniform at the back as much as possible and fasten the waist ties or belts. The rationale for this is that overlapping securely covers the back of the uniform and the waist ties keeps the gown from falling away from the body, which can cause inadvertent soiling of the uniform. Now, wear the face mask or apply the face mask. This is the face mask. Then, locate the upper edge of the mask. The mask usually has a narrow metal strip along the edge. Here is the upper edge, and hold the face mask by the two strings or the loops. Then, place the upper edge of the mask on the nose bridge and tie the upper strings at the back of the head or secure the loops around the ears. If wearing a glass, place the upper edge of the mask under the glasses. The rationale for this is that when the upper edge of the face mask is under the glasses, clouding of glasses is less likely to occur. Then, secure the face mask under the chin, then tie the lower strings at the back or at the nape of the neck.
The rationale for this is that for the mask to be effective, it must cover both the nose and the mouth where the air comes in and out.
If the mask has metal strip, adjust it firmly on the nose bridge. The rationale for this is that fit prevents the escape and inhalation of microorganisms from the edge of the face mask and the fogging of glasses. Wear the face mask only once and do not wear it longer than the manufacturer's instructions, because the rationale for this is that mask is only wear once as it becomes less effective when moist. Then, do not let the used face mask hanging around the neck, and the practice guidelines provide further information about applying the mask. Now we proceed in applying the eyewear if not yet combined with the mask. Assuming that this is the proper and appropriate eyewear, now we apply or wear the gloves. There is no special technique in applying or wearing the gloves, but if you are wearing a gown, pull the gloves up to cover the cuff of the gown. But if not wearing a gown, pull the gloves up to cover the wrist. With the other hand, now that we are already done with donning of the personal protective equipment, we now proceed in doffing of personal protective equipment. So to remove the personal protective equipment, we first remove the gloves, which is the most contaminated. If wearing a gown that is tied in front, untie first before removing the gloves. Then, remove the gloves by rasping the palmar surface, taking care of touching only the glove to glove. Palmar surface. The rationale for this is that this keeps the soiled part of the gloves in touching the skin of the wrist or the hand. Then pull completely off by turning or rolling inside out. Continue to hold the gloves with your fingers. Then place first two fingers inside the second glove, inside the cup of the second glove. The rationale for this is that touching the outside of the soiled glove with the bare hands is avoided. Then pull off the second glove by turning it inside out so that the first glove is now inside the second glove. The rationale for this is that the gloves are now folded to the inside to reduce the chance of microorganisms transmission on our hands. Then, by using the bare hands, continue to remove the gloves. Then, discard it in the appropriate container. Now, perform hand hygiene. The rationale for this is that Contact with microorganisms while removing the PPE can occur. Now remove the eyewear and dispose it properly, or place it in the appropriate receptacle for cleaning. Remove the gown when preparing to leave the room. So avoid touching the outside parts of the gown if possible. The rationale for this is that the top part is contaminated or may be contaminated. For example, if you have been holding an infant with a respiratory infection. Grasp the gown along the inside of the neck and pull off the shoulders. Make sure that you only touch the inside of the gown. Do not shake the gown. Roll up the inside of the gown. Then discard it in the appropriate container. Then remove the mask. Remove the mask at the doorway of the client's room. If it is a respirator mask, remove the mask after leaving and closing the door. If using a mask with strings, untie the lower part of the strings first, because the rationale for this is to keep the upper part of the mask from falling into the chest. Then, untie the top strings, and while holding the strings securely, move it away from the face. If side loops are present, lift the loops and move it away from the ears and the face. Do not touch the in front of the mask. The rationale for this is that the front of the face mask where the nurse has been breathing is contaminated. Then discard the disposable mask on the appropriate container. Then perform hand hygiene again. Now going on with the evaluation, conduct a follow-up if indicated during the care with the client, and if there has been a failure to equipment or a potential exposure is suspected, follow the procedure in the practice guidelines. Ensure that there is an adequate equipment for the next healthcare workers. So that is all. Thank you and God bless.